Hello, my name is Honey Guardado, and this is a presentation for the class Leading the Future of Healthcare based on Jordan, Minnesota Community Health Assessment and Proposed Healthcare System Change, Windshield Survey, Environmental Analysis, and Strategic Initiatives. An overview of Jordan, Minnesota. The population is approximately 6,700. A median age is 35.4. Median household income is 110,139. Home ownership is 86.4%. The poverty rate is 6.1%. Uninsured under 65 is 4.6%. When it comes to the Windshield Survey findings, the strengths are well-maintained downtown infrastructure, strong homeownership and income, access to local businesses and community resources. However, it has some weaknesses like limited public transit, incomplete pedestrian biking infrastructure, potential gaps in preventive and behavioral health services. Their opportunities are to expand preventative health programs, improve pedestrians and biking infrastructure, develop recreational spaces. The threats are seasonal flooding, trafficking hazards, limited healthcare access for non-drivers, underreported chronic disease, behavioral health. Some environmental analysis: mixed residential housing, older homes and newer developments, infrastructure well-maintained downtown, however the gaps in some neighborhoods, environmental concerns, seasonal flooding and traffic hazards, limited recreational spaces in some neighborhoods. Social determinants of health: the socioeconomic status, education, employment, housing, transportation, limited transit affects elderly, low-income, and disabled populations. Healthcare access influenced by insurance and provider availability. The community resources have a problem: farmers markets, park, educational programs. Public health implications: chronic disease prevalence, diabetes, hypertension, cardiovascular risk, rising behavioral health and substance use concerns, limited access to preventative and behavioral health services, vulnerable populations impacted by transportation and socioeconomic status and barriers. Proposed healthcare system changes: expand the preventative care programs, increase access to behavioral health such as telehealth clinics, adopt value-based care models, and enhance community-based wellness. Benefits of the proposed changes: reduce preventable hospitalizations and ED utilization, improve chronic disease management, increase access to behavioral health and preventative service, enhance patient satisfaction to the community resilience. Barriers to change: the workflows shortage, funding constraints, community resistance, and limited transportation options. Strategies for changes: infrastructure investments, sidewalks, bike path, flood mitigation, telepath expansions, community wellness programs, targeted support for vulnerable populations. Stakeholder engagement: key stakeholders like city leadership, healthcare providers, community organizations, residents influence the decision-making, funding, and implementation. And strategy is a clear communication, data-driven evaluation, and collaboration. Evaluation of change initiative: oversight, the project manager and advisory board, frequency, quarterly progress reports, annual review, recipients, city leadership, healthcare providers, funding agencies, stakeholder involvement, feedbacks, implementation, and impact. This is the project budget summary where you can see the categories and the startup for the first year and the justification. To conclude this presentation, Jordan is a stable, growing community with strong demographics. However, the challenges that has as preventative care gaps, behavioral health, infrastructure, transportation. The proposed changes are improve access to reduce disparities and promote wellness, and collaborated data-driven approach ensures sustainable improvements. These are the references for this presentation. I hope you enjoy it. Thank you for watching.